right, so we have hit our halfway mark. At this time, we'll do a new segment that we have called Quick Answer Segment. In this segment, I'll ask Dr. Vanderbilt a couple questions, and he'll give me a quick answer, just like that. You ready?
Yeah.
All right. Number one, are electric toothbrushes better than manual toothbrushes?
So the question is, are electric toothbrushes better than the manual toothbrushes? Absolutely yes, and I can quote a variety of studies, and they were able to prove that the electric toothbrushes are slightly better than controlling the bleeding and the gingivitis. And personally, I use this as an electric toothbrush, and I'm going to say that electric toothbrushes are definitely slightly better than the manual toothbrushes.
Number two, what is the most common dental issue among the adult population of Texas?
So the question is, what is the most common dental issue among the adult population in Texas? And I'm going to twist the question and then say, what is the most common dental disease in the United States, or what is the most common dental disease in the world? Most common dental disease, half of the adult population in the US have periodontal disease or the gum disease. Or if you look at the world, like maybe about 60 to 70% of the population have periodontal disease or gum disease. And the second most common disease, 25% of the adult population in the United States have cavities or dental caries, or about 40 to 50% of the population in the entire world have the dental caries or the dental cavities.
In the world.
In the world.
Not
Did you
just,
know that?
Not just Texas.
Not just Texas, man. Yes.
All right. Can you identify a frequent error people often make in their oral hygiene routine?
So I can pick variety of them, and because you said it's a rapid fire round, like a quick question, so I'm going to take to maybe say top three. So the top three things that people make in their dental oral hygiene is they do not brush for enough time. So the average American, they brush for about 30 to 45 seconds, whereas the average should be about 2 minutes. I see usually pick a quadrant, like 30 seconds each, 2 minutes you got to brush, and you got to brush twice a day. They do not. They brush once a day. They are supposed to floss at least once a day. They do not floss. And they are supposed to brush the inside of the teeth as well as the outside. They do not. And so these are the most common errors. And so brush twice a day, floss at least once a day, at least brush for 2 minutes. And these are the most common things.
All right. Do brown teeth necessarily indicate poor oral health?
So the question is, do brown teeth necessarily indicate poor oral health? It does not. So brown teeth could be due to like a variety of reasons, as simple as you grew up in a place where they did not have enough fluoride. So we do like we see a lot of ethnic patients here. They come from different parts of the world, and some of them got brown teeth. In the place they grew up, they did not have enough fluoride in their water, and that's why their teeth kind of brown, they look brown. Or maybe during their adolescent period, they had to probably take some medications for their acne or other antibiotic, and that made their teeth look brown. So brown teeth does not necessarily mean that you have poor oral health. It could be to a different reason. And as long as you maintain it, you can have brown teeth for the rest of your life. You are still able to maintain them healthy.
Okay. Last question for the quick answer segment. You ready for it?
You got it, man.
All right. What is the primary indication of one early signal of gum disease?
So the question is, what is one of the primary indication for an early sign or early signal of gum disease? The most common thing that you are able to notice, you don't have to be a doctor, you don't have to come to me, don't waste your time, come to see me, or don't waste your money to come see us or any dentist. The most common sign or the signal is the bleeding from the gum. Bleeding, pain, and swelling and loose teeth. These are the most common signs of gum disease, and bad breath also. So if you are seeing any of that, bleeding, swelling, bad breath, and loose teeth, immediately that is a sign or the signal of the gum disease. Yeah?
Ooh.
You got it?
You made it through a quick answer segment.
Thank you. Thank you.
All right. All right, so back to our questions.
Thank you
that
for
our
the
followers-
compliment, ma'am.
You're welcome.
Yeah.
I specialize in compliments.
Thank you.
Okay,